Hey everybody, today we're going to be going over Chapter 7, Anatomy and Physiology, and Medical Terminology. In this chapter we're going to be going over some various anatomical terms and medical terminology and body systems that you will be hearing used in the medical profession. So you need to have a understanding of it, because having a knowledge of this and having a knowledge of what the human body is needed for us to be able to assess and care for our patients. Basic knowledge of the human body includes the study of our anatomy and physiology. The word anatomy refers to the structure of the body and the relationship of its parts to each other, or how the body is made, whereas the word physiology itself refers to the function of the living body and its parts, so how the body works. So anatomy is how the body is made, whereas physiology is describing how the body itself works. And all of it together is what we need to know, so we know, all right, if I'm looking here, this is what organs are here, but how do those organs work within the body? So having a knowledge of this, having a knowledge of the body systems is essential to being able to provide high quality patient assessment and emergency care. This knowledge will help you recognize when the body is working as it should and when life-threatening deviations to normal function are present. Also, being able to use proper terminology to describe the human body will allow you to concisely and accurately communicate information of the patient to other healthcare professionals in a concise method. For starters, one of the terms that you are going to have to know and be able to understand is the anatomical position. This position is what we use when we reference anything that has to do with the body. So the anatomical position is when the patient is standing straight up, facing forward, their arms are down at their side, and their palms are facing forward towards you. This position is what we use as a point of reference whenever terms of direction or location are needing to be used. So if I need to say something is distal to something, that means it's coming away from the body. There are various positions of the body that we may find our patients in, or we may place them into. So oftentimes we need to be able to ensure that when we're discussing things or charting stuff, that we know what terms we're using properly, and as far as our treatment for the patient, that we're also applying them in the correct position as well. These positions include supine, prone, lateral recumbent, Fowler, semi-Fowler, Trendelenburg, and the shock position. The supine position is when a patient is lying face up on their back. They're laying completely flat, just like when you're laying in bed. Okay? The prone position is when a patient is lying face down on their stomach. Lateral recumbent or position, or another term that you might hear this called is the recovery position, is when the patient is lying on either the left or right side, and we place this patient on their side in the event that they're possibly unresponsive or nauseated, to where they're in a comfortable position, and they're also in a position that they're able to maintain their airway, and we're able to monitor their airway. Another thing that we may do is, so that way we don't impair blood flow to the arm that they are laying on, we may have them move over to the other side if they're going to be in that position for greater than 30 minutes. So if they're on that position for 30 minutes, we want to roll them over, so that way we give that arm a break. The Fowler's position, this is a position when they are laying on their back. However, we have their upper body elevated to an approximately 45 to 60 degree angle, so we have them sitting up. Semi-Fowler's position is when a patient is lying on their back with their upper body elevated at an angle less than 45 degrees. So this is a position that we'd have to set the stretcher to. Trendelenburg position, this is a position where the patient is lying flat on their back, so they're laying supine. However, we have their body inclined to where their legs are elevated higher than their head. This used to be a position that providers would use to treat patients that were in shock. However, this is being phased out due to the increase in breathing problems that some patients were having, as well as the blood being rushed to the patient's head, and if they have a potential head injury, it causing an increase in intracranial pressure and causing worsening of the patient's condition. So now the alternative to this is the shock position. In this position, this is the position that we generally do for patients that are in shock. How we have them laying flat, just like we have them laying in the supine position. However, instead of completely inverting the stretcher to now where we're lowering the head and raising the feet, all we are doing is raising the feet of the stretcher. And that is it. So their body's laying flat, but their feet are propped up. Okay? So this is the supine position. Patient's laying completely on their back. Prone position. Right lateral recumbent or right recovery. Left lateral recumbent or left-sided recovery. Fowler's position. So as you can see, let me get my laser pointer. The patient is sitting up at about a 60-degree angle. Semi-Fowler's, the stretcher would be down right about here. Be about half of that. And then the shock position, as I said, you have the patient laying flat, but we raise the foot of the stretcher up so that way their feet are elevated, and it helps get blood flow back into the core, back into their heart. We also have anatomical planes that we have, and what this does is it cuts the body into reference points for us. And these planes and lines help indicate internal body structures and the relationship of these groups of organs to others. So we have the sagittal, mid-sagittal plane. The sagittal plane or the median plane is a vertical plane that runs lengthwise and divides the body into a right and left segment. These segments don't have to be equal. So you can do it, halfway on the left if you need to cut that plane. But if you run this plane directly down the middle, and it is completely running down the middle, this is what we call the mid-sagittal plane. The frontal or coronal plane, this is what divides the body into a front and back half. The transverse plane or horizontal plane is what is parallel with the ground and divides the body into an upper and lower halves. You may also use this referred to as what's called the axial plane as well. The midline, so you want to imagine, think of the normal anatomical position, so the patient is facing you. Now imagine this line drawn vertically through the middle of the patient's body, beginning at the top of their head and going down through the nose, through the navel, and all the way down to the ground. This midline also corresponds with the mid-sagittal plane. So you're going to use midline and mid-sagittal. You're going to hear that term used interchangeably. Okay? But if you hear mid-sagittal or midline, that means it is going straight down the middle of the patient. Mid-axillary, once again, you have a patient standing in the anatomical position. However, now we're drawing a line from the patient's armpit down to their ankle. This is what's called the mid-axillary line. Your armpit is also called the axilla. Okay, so that's where you get mid-axillary from. The transverse line is an imaginary line cut through at the patient's waist. This is the transverse line. This is where it's cut between the upper torso and the lower extremities. This is also considered, we also divide the body into two planes based off of this. You have the superior plane above the transverse plane and the inferior plane, which is below the waist. Okay, so here you have the sagittal plane that cuts the body in half. This is also called the what? Right, this is also called the midline. Right? We also have terms of direction that we may use. Terms such as anterior, which means towards the front. So we're talking on the front side of the body. Whereas posterior or dorsal, think of a dorsal fin on a shark, means on the back, posterior side. Medial, that means towards the midline. Whereas lateral means away from the midline. Unilateral refers to one side. Ipsilateral refers to the same side, and contralateral means to the opposite side of something. Okay, so you're going to hear those terms as well. Lateral is left or right of the midline. Medial towards the midline or center of the body. We also have terms for meaning near a point of reference or further from a point of reference. So you have distal and proximal. So if I have a cut here, I may say I have a laceration proximal to the elbow. So near the elbow. Whereas if I say distal, it means away. So if I have a cut here, I may say I have a cut distal, a laceration distal to the elbow. So now I mean I'm further away from the elbow. Plantar is in regards to the foot. Let's see. Palmar refers to the hand. As I said, superior towards the head, towards the top. And inferior means towards the foot. We also have various regions of the body. This is on page 133. I would recommend looking over this page and definitely learning some of these regions, such as the cervical and occipital region, the popliteal, where the popliteal region is, the lumbar and thoracic region, the lower extremities, the cervical region, the cranial region. Those would all be terms that you're going to hear a lot in this class. We also have terms that describe various areas within the body. So when it comes to the anterior chest, we have the intercostal space. This is the space in between each rib. The sternum, which is in the center, is our breastbone, which is in the center of our rib cage. And you have the xiphoid process, which is the bony tip at the bottom of the sternum. You have the costal margin. These are the areas where our floating ribs are, or our ribs that don't completely articulate to our sternum and are connected mostly by cartilage. Let's see, your clavicle, your substernal notch, your trachea. This is all across down the mid-sternal line. Your trachea, substernal notch. Let's see. Midclavicular. These are terms that this is another one that you are going to hear definitely when we start getting into our EKGs and doing 12 leads, because you have a line that goes half down the middle of the clavicle, and this is called the midclavicular line. There's also terms for the next slide. For the posterior chest, you have your spinous process. These are the bony back ends of your spine. You have your scapula, your mid-spinal line. So you have we had the mid-sternal line. We have a mid-spinal line. In terms to the lateral chest, as I said, your armpit is your axillary. So hence, that line going directly down the middle would be the mid-axillary line. Your anterior axillary and posterior axillary line is both in front and behind the axillary. within your topographical anatomy, I would recommend looking over this as well. Because you're going to hear certain words when it comes to uh, that you may have heard before to describe these, such as your humerus, the funny bone, your sternum, which is the breastbone, your maxilla and mandible is your jaw, maxilla being your upper jaw, mandible being the lower jaw, your scapula being your shoulder blades, your femur being your biggest bone in your leg, your patella or your kneecap, your tibia and your fibula, or are the bones in your lower knee, your coccyx or butt bone, your calcaneus or your heel bone, and that bony part that you can't really see it where it's pointing at, but right here, this part that protrudes out of your ankle if you're feeling down your foot is what's called the malleolus. Within our upper torso, we have also main cavities that that our organs run out of. So you have your cranial cavity, which is where our brain is contained. Your spinal cavity, which is where your spinal nerves run through. Your thoracic cavity, where your heart and lungs and greater in your aorta and the larger portions of your vena cava are at. And also your diaphragm is what separates the thoracic cavity from the abdominal cavity. The abdominal and abdominal pelvic cavity is where your various organs that are within your abdomen are contained, such as your bladder, your stomach, your intestines, and your spleen, kidneys. Within the abdominal cavity, we split it up into 4 quadrants. This is illustrated on page 136 in your textbook. I would highly recommend looking over this this section, so that way once we get into our chapters, once we start actually going through and doing our assessments and stuff, when we give you stuff and we say you have tenderness to the right lower quadrant, okay, what organs are there? Well, I have my colon, my appendix, my small intestines. Okay? So that way you can try to start figuring out what's going on with your patient and treat them accordingly based off their signs and symptoms. Our musculoskeletal system, this is our bony framework. This is held together by ligaments. These ligaments connect bone to bone. Then you have layers of muscles, and these muscles have to be connected to the bones somehow. These are connected through tendons. So tendons connect muscle to bones. This system has to be very strong, because you have to think about it. It has to be able to support us, be able to keep us upright. This is what gives us shape. This also protects our organs in our chest, our brain, our spine. This also allows us to be able to move, and it has to be able to withstand stress of us moving around. I weigh 220 pounds. It takes a lot of strength within my bones to be able to hold up a 220-pound man when I'm moving or running or carrying my medical equipment. It also helps with storage, because it helps store certain minerals such as calcium. Also produces blood cells within our bone marrow in the center of our bones. There are 6 basic components of our skeleton. You have the skull, which is in our head, our spinal column, the thorax, which is our chest and torso area, our pelvis, which is on our hips, and our upper and lower extremities, which consist of our arms and legs. Beyond that, bones are then classified based off of their size and shape, such as long, short, flat, or irregular. Within our skull is made up of, let me think for a second, 1, 2, 3, 4, 5, 6 bones. You have a frontal bone, 2 parietal bones, 2 temporal bones, and 2 occipital bones. Now, when we are born, this is a very loose, so they're not fused together yet, but as we continue to age, they become hardened. And this is what protects our brain. Also within our skull, you have your nasal bone, your orbit, which is where your eyes are contained, your maxilla, and your mandible, which is your jaw, lower jaw being mandible, upper jaw being maxilla, your zygomatic bone, which is your cheekbone, your temporal bone that I was pointing at, that's your temple, occipital bone, just in the back of your head. Now, if you have any kind of head trauma, because these bones are fused together and they do not allow it to be moved, it doesn't do very well when our brain begins to swell. When we have patients with potential head injuries and we have potential swelling of the brain, this is a critical emergency and we need to get our patients to the hospital to try to reduce that swelling. Then you have your spinal column. Your spinal column is a column of 33 stacked vertebral bones, each of them separated by a disc. You have 7 bones in your cervical spine, which make up your neck. 12 bones within your thoracic, with each one articulating to a rib or connecting to a rib. You have 5 lumbar bones, 5 bones in your sacrum, and 4 bones in your coccyx. Now, the bones of your sacrum and coccyx, both of these make up a portion of your pelvis. And these bones are all fused together. They are one piece. The bones of your lumbar, these allow you to bend forward and backwards. Your thoracic allows for minimal movement, but not enough to where you would be able to bend forward. There is hardly any movement in these bones at all. Your cervical spine, these allow you to not only to bend your neck forward and backwards, but also left and right. Within your thorax, you have your scapula, your humerus. You have your 11 thoracic vertebrae, as well as 12 pairs of ribs, or 24, that attach on the backside to a thoracic vertebrae. You have your first 7 pairs of ribs that attach to your sternum. Your next 3 attach indirectly. And you have your last 2 pair of ribs that are not attached to all or are free ribs. Within your pelvis, you have your ilium, which is your hip bone, your pubis, which each of these, there's actually a symphysis which connects your left and right hip. Your sacrum and your coccyx are all contained within your pelvis. Your ischium, the acetabulum, I know it's not labeled, but this is where your acetabulum is, where your femur connects to your pelvis. Your lower extremities, you have your femur, your knee joint, which is protected by the patella or your kneecap. In your lower leg, you have the tibia and the fibula, tibia being the front, fibula being the back. Did you know that you can actually break your fibula and still be able to walk? Because your tibia is actually the weight-bearing bone as far as your lower leg. your tarsals and metatarsals that make up your ankle and your foot, and then your phalanges, which make up your toes. Within your upper extremities, you have your humerus, scapula, humerus being your aka funny bone. Now, there's not an actual bone that makes up your elbow. Your humerus actually forms a joint with the arms in your forearm, which makes up your radius and your ulna. Now, to remember which one is which, your radius is on your thumb side. So if you put your thumb up, that bone that follows your thumb as you go into your lower arm, that's your radius. Then you have carpals that make up your wrist, your metacarpals, and then your phalanges, which make up your fingers. We also have various joints within our skeletal system. You have those immovable joints that make up your skull, that are all fused together. You also have slightly movable joints that make up your vertebrae, and then freely movable joints that make up your joints, such as where your femur meets your pelvis. So that way it allows you to be able to walk. Alright, we're going to take a break here. When we come back, we will pick up with motions of the joints. If y'all have any questions, just let me know. I'll see y'all in just a bit. Where's my mouse? There it is.